Hi everyone, welcome back. In today's video, we are going to talk about the anatomy of the humerus. The humerus is the principal bone of the arm. Its name comes from the Latin word for shoulder, reflecting its connection to this region. The humerus is crucial for arm mobility as it forms joints on both ends. Proximally, it articulates with the scapula at the glenohumeral joint, while distally, it articulates with the radius and ulna at the elbow, allowing the hinge and pivot movements. To understand the humerus better, we have to cover its primary bony landmarks and their significance. So let's start with the proximal humerus. The proximal humerus, we have number 1, the head of the humerus. The head of the humerus is rounded, smooth, and dome-shaped. It articulates with the glenoid cavity of the scapula to form the highly mobile glenohumeral joint. Now, talking about mobile, only about 1/3 of the humeral head fits into the glenoid cavity. This provides mobility at the expense of stability. Number 2 is the anatomical neck. The anatomical neck is located just below the head of the humerus. It acts as a boundary between the head and the rest of the bone. Number 3, the surgical neck. Surgical neck is found below the anatomical neck, encircling the humerus. Fracture to this area may damage the axillary nerve and the posterior humeral circumflex artery. Number 4 is the greater tubercle. It is larger and it is a lateral prominence on the proximal humerus. It serves as point of attachment for 3 of the 4 rotatory curve muscles: the supraspinatus, the infraspinatus, and the teres minor. Then number 5 is the lesser tubercle. It is actually smaller and it is an anterior prominence. It serves as point of attachment for the 4th rotatory curve muscles, which is the subscapularis. So now you have to remember this. The greater tubercle serves as point of attachment for the supraspinatus, the infraspinatus, and the teres minor, while the lesser tubercle serves as point of attachment for the subscapularis. Now, number 6 is the intertubercular groove. It is the groove between the greater and the lesser tubercle. It houses the long head of the bicep bronchi tendon. So that is it for the proximal humerus. Let's move over to the mid-shaft of the humerus. In the mid-shaft of the humerus, you'll find the radial groove and the deltoid tuberosity. So let's talk about the radial groove or the spiral groove. It is located posterior on the humerus, and it contains the radial and the deep bronchial artery. Fracture in this region may injure the radial nerve, affecting wrist and finger extension. Now, over to the deltoid tuberosity. It is a roughened area on the lateral shaft of the humerus. It serves as point of attachment for the deltoid muscle. Now you see its name, deltoid tuberosity. It serves as a point of attachment for the deltoid muscle. So that is it for the mid shaft of the humerus. Let's talk about the distal end of the humerus. In the distal end of the humerus, you find number 1, the trochlea. The trochlea is a pulley-like structure on the medial side of the distal humerus. It articulates with the ulna to form parts of the elbow hinge joint. Number 2, capitulum. The capitulum is a rounded dome-shaped structure on the lateral side of the distal humerus. It articulates with the radius, allowing pronation and supination. Number 3, the medial epicondyle. The medial epicondyle are large prominence on the medial side of the distal humerus. It serves as point of attachment for the foramen flexor muscles, and it is a landmark for the ulnar nerve, which passes behind its cubital tunnel. trauma here can cause the funny bone sensation due to compression of the ulnar nerve. Then number 4 in the distal humerus is the lateral epicondyle. The lateral epicondyle actually smaller prominence on the lateral side of the distal humerus. It serves as point of attachment for the foramen extensor muscles. Then number 5 is the coracoid fossa. The coracoid fossa is a shallow depression on the anterior distal humerus. It accommodates the coracoid process of the ulna, allowing elbow flexion. Then finally, number 6 is the olecranon fossa. It is actually a deeper depression on the posterior distal humerus. It receives the olecranon process of the ulna, allowing elbow extension. Now, finally, let's move over to the clinical importance of the humerus. Number 1 is fracture. Now, surgical neck fracture may damage the axillary nerve and the posterior humeral circumflex artery. And mid-shaft fractures can risk injury to the radial nerve, causing wrist drop. Then medial epicondyle fracture. This can affect the ulnar nerve, leading to a sensation loss or weakness in the arm. So number 2 under clinical importance is joint function. The humerus is integral to the glenohumeral joint, which is the shoulder joint, and the elbow joint. So any form of dislocation to this region is actually going to hinder a wide range of motion on the arm. So in summary, the humerus is actually a vital bone for arm function, and it serves as point of attachment for muscles, and it also forms joints that allow mobility of the arm. Now, this video is simply an overview of the anatomy of the humerus. You can source other material to read more extensively on the humerus. If you like this video, please don't forget to like and subscribe. And I'm also wishing you luck in whatever examination you are preparing for. Until next time, thanks for watching.